Tune in to I-95.5 FM every Tuesday from 8 p.m. for Live Night. Live Night. With Dr. Wayne Dellamore from Natural Health Solutions. Enjoy a program of dialogue and have your questions answered. Natural Health Solutions, delivering a natural solution to healthy living on I-95.5 FM.
Good night, TNT. Let me say a pleasant evening and greetings to those of you who took the time to tune in this afternoon. And I want to say we have a power pack evening this evening. Power pack evening. We don't want you to touch that dial, don't change it because it's going to be informative as usual. And we decided to have these live nights to really educate the people on the issues that are affecting us in Trinidad and Tobago. These issues where it's become almost a pandemic. Last week we spoke about, we dive into diabetes and blood sugar imbalance and what we can do to detect it, to heal the body from it. Tonight, however, we're dealing with the whole issue of arthritis. That degeneration that takes place in the bones and joints as we get older. Now, some people may say it's because of old age, but we are here to negate that tonight. It could happen to anyone, but it happened because we're going back to the foods again. The foods. This is what we refer to as a lifestyle disease, meaning that lifestyle is what causes it. And we are saying we can use lifestyle to reverse the issue of arthritis. Now, first of all, let me put in a context. Arthritis starts with something called osteoporosis, which is a degeneration of the bone at grade, and the bones become porous over time based on what he's a well-known therapist, and he's going to go into some of the physical therapies we can do to help with mobility and help to get back that ease in the bones and joints and how to help the body to heal in that part. So we're looking at the side of nutrition, and we're also going to look at the side of the therapies, what can be done to help the body to restore itself. So we're going to go into that this evening. We're going to open the lines a little later tuned where you can call in and ask questions in terms of the discussions tonight is arthritis and how we can prevent that by the way we eat. So we're going to go right into my colleague here with me, and of course his name is Miguel, and Miguel is our onboard therapist who have a range of massage therapies that can really help the body to heal and bring back the mobility that some people don't have in the bones and joints for different reasons. I've seen what he have done with so many people coming to the clinic. They can't walk too well, and after a few sessions, they're walking without a cane. Tonight I want to just get things that you have done and what we can do a natural solution to help persons who have issues at work and how we can help them in that area.
Good night, Trinidad and Tobago. My name is Miguel Solomon. I have been doing massages on a therapeutic level since 2017, and I've seen many cases where once in early detection we were able to reverse the whole process of arthritis, because most people have the shake off mentality where they would experience pain and ignore it. Mm-hmm. What we at Natural Solution do is that we detect the slightest signs using the blood, and what we also do to see what's going on the inside. In terms of the therapy, every case is different, right? There's no one-way fix. And the person who's experiencing the symptoms need to observe themselves, because it could be a quick fix or it could require a lot of work to be done, because the person would have been harboring the pains for so long. But what we do at Natural Solution is that the first thing we do, we'll sit and have a conversation with you. In this conversation, we'll look at your lifestyle, we look at your daily activity to see if we could detect if it's something lifestyle-wise or if it's something that was incurred. The conversation that we'd have, we would then decide our plan of action. The plan of action begins with something called a palpitation, where we physically examine the body to see any signs and symptoms. With arthritis, there's a mass tends to form around the bone. This is because the bone itself has lost something called synovial fluid, or it loses, fused together, resulting in you getting pain. As for the treatment for that, what we do is that we try to force fresh blood, oxygenated blood into that area, so that it would ease the pain firstly by the blood trying to bring fresh tissues. Now, every baby between the ages of 0 to 9 has this thing called cartilage. Every baby between the ages of 0 to 9 has this thing called cartilage. We, as adults, lose this cartilage by the age of 25. At the age of 25, the activities of the outside world tend to affect our bodies. And this is where the diet and the things that we put in our bodies can assist us. Due to the lifestyle, we also need to exercise, and also we use therapies based on different modalities which would assist the body to regenerate new blood cells. We use something called deep tissue, where we use the hands to force the blood, using the hand by using different techniques, where we rub different skin layers, causing the body to produce new skin cells, new blood cells, where the blood is forced into what seems to be starved of oxygenated blood. This technique is something that is done in the early stages of this method may be effective, but there are other methods such as the hot stones in more chronic cases. So based on what is detected when the palpitation takes place or the examination takes place, then we would decide on what method of therapy would be used. There are different types. I would go into a few of them with you shortly.
The person can get help.
Yes, they can. Once the area, all right. Once that we may, all right, we are engaging in a physical activity, and whilst doing this physical activity, we get a pain. We are supposed to examine that particular body part to see why this pain was caused. But the typical, right?
Because the body's giving us signal something is wrong.
Right. There are two. I was letting you go into it, but I'll go into it right now. There's something called osteoblasts. Osteoblasts build bones.
Mm-hmm.
Osteoblasts is 0 to 25. Osteoclast tends to eat up the bones.
Mm-hmm.
there's a balance between the body, between the osteoclast and the osteoblast. But as time go by, and due to the activity that we do, the osteoclast tends to eat up the bone cells.
At what age this can begin to happen?
From 25.
From 25?
From 25.
So it's not just an old people thing?
No, it's not. What happened is that based on the activities that we are doing, and based on and things that we would have inherited from we tend to inherit certain illnesses, and these illnesses should be flags for us to look at. Not just for arthritis, but you need to look at your family traits. See what granny had. See what is the challenges she had, and try to live a life that you take it early, where you could detect and look for these things. See what you need to cut out in your diet. See what you need to not do, so that you wouldn't have the same outcome as your grandparents. Simple things as having the correct body posture can save you a lot. Right?
I notice that people now, when they go in the bank, nobody is fretting and getting phone curved back, and young people are growing up with curved back, and there's a problem with in the prostate, in the way you drive,
yes,
or you sit.
Even all right, most people, they do have an age. It used to have an age, but if you would notice with arthritis, you would see most people go outward.
Okay.
Based on the diet people are having these days, they tend to become overweight, and then the joints now is forcing to support the body against gravity. So the muscle, some bones tend to form something like all right. When it is you get a cut, let me say a white man, it is form a scab. Picture the scab forming around your joints due to inflammation. The same co-pit. All right. So what happened? This mucus, then yellow, then gray, then black. That is what's going on at your joints. So it's been destroyed due to the osteoclast. The osteoclast eat it up. Bone and bone effect. You start to feel a pain lasting. It's simple. I will go into this one, the osteoarthritis, where it has an indicator, which is you would get a pain in the morning for 30 minutes or less. This is because the bone is rubbing on the bone, and the acid level in your hand, this could be in your knee, this could be your back, this could be in your hip. And the body is saying, here what happened? We rubbing on one another, and we would ignore that. This is because we are drinking the acid juice, the thin stuff juice.
And we're on that topic. I want to dive in a little bit about the nutrition. Foods, as I said before, is the X factor. Last week I spoke about so many things that you can eat to cause blood sugar imbalance. It's very similar with arthritis. Now, doctors call this an autoimmune disease, meaning that the body is attacking itself. However, we have a different approach to that. The body is not really attacking itself. The body is trying to go in survival mode. So based on what you eat, the food which is high in carbohydrates, and carbohydrates can spike acid in your body more than normal sugar. People know it's really bad. The donuts, the pizzas, the fast food that you eat in, the refined sugar, the refined carbohydrates, the alcohol. Alcohol is highly acidic. There's something called the pH, which means potential hydrogen. Your blood, the body will try to protect the integrity of the blood pH. And when the blood becomes very acidic, which is something we can see in our assessment at the clinic, we know that the body starts to pull alkalinity or minerals from the bones and joints and even the organs. The bones start to become very porous. As I say, it's a degenerative process. So the first step is osteoporosis rather, before it becomes osteoarthritis. So if we look at an alkaline chart, you want to eat more on the alkaline side, and you want to avoid anything that's acidic. That includes soft drinks, energy drinks, alcohol, beverages, certain type of energy drinks, even tomatoes, things that is acidic, oranges, Portugals. There's a list of things we have in the clinic for you to avoid to eat, and you want to live on the alkaline side. So fruits like watermelon, pawpaw, cantaloupe, these are things you can eat because they are alkaline. Because as the acid begins to get pain, I know in Tobago, I have clients over there, they love lime juice. The reason lime juice is a big thing. But when you take lime and lemon and you add sugar to it, it supercharges the acidic compounds. It would not convert to alkalinity. And if you drink lime juice, you become the weatherman, the weather woman. Because immediately the temperature, your pain starts to increase. And this is something we could eat of, which is we're talking the osteoporosis tonight. The body is trying to protect itself. And because the body is lacking minerals, it's going to pull minerals from the joints and the internal organs. And once that happens, the bones become porous and weak. And that can become osteoarthritis, where the pain steps in. And sometimes it could be osteo or rheumatoid, which could be crippling. So we call the osteoporosis the mother of the family. The father is Mr. Arthur. He's arthritis. You have a terrible aunt, which is rheumatoid. There's a family. And then you have something called gout, which is his son. And that could be extremely bad. It begins to calcify in the blood. And when that acid remains in the joints, or your toe, your finger, is extremely painful. We are saying these things could be prevented. I think we examine what's going on with the body. We have something we call the bioresonance, which we take a deep dive into the organs and tissues. We can pick up that osteoporosis. We can pick up the gout. We can pick up all these degenerative processes in the body. So it's not that the body going crazy as autoimmune. The body is simply trying to protect itself. Some of you putting on a lot of weight. Why are you putting on all this weight? The body is going to create fat cells to dump the toxins and the acid. It can't handle it anymore. So you're going to create this fat tissue. Usually on the belly, the face, the butt area. But the body is trying a way to keep the acid away from the blood. Because the blood become more than 7.3 in the pH, it can kill you. The blood needs to be at a certain alkaline level, 7.35. When it goes 7.4 on these levels, that is very dangerous. So we advise people what to eat and how to eat. Avoid eating things that can cause the problem. Remember, the carbohydrates. So you may be getting pain and you're taking ibuprofen and other painkillers. But what you're eating causing the inflammation. The wheat bread is triggering inflammation in your body. Do you know even the white bread, these things have certain wheat products that will trigger inflammation in your body? And you don't know, but you're eating the things that cause the pain. You drink a little brandy, a little alcohol, problems and chaos. Anybody, because we're not getting the alkalinity there at all. And we are saying there's a solution for it. And a natural solution, that's what we do. We get a natural solution to balance the body so the body could begin to heal. And there are a number of supplements out there, for example. There's something called caltrate. I want to mention I'd be very wary. They can calcify in the blood because most of them are synthetic. I remember a client came back some time ago and she used 6 bottles of caltrate. She ended up with about 6 to 7 stones in her kidney. And this is why some doctor might tell you to take some this month, skip next month. Because these things calcify in the system. There's one thing to eat minerals and nutrients, but you need to get it from a natural source. This is the difference when it comes to natural solution. We understand minerals and nutrition, and we ensure you get from a natural source and not something made in a lab. And this is why I tell our clients we prefer to use it from the food. So things like kale, things like watercress, you can juice these things so you can get the calcium component from it. We're going to give you some tips tonight of things you can use right at home to help the body to regenerate. Tell the body to get rid of all this acid buildup, because acid is a killer. It's going to cause pain. It's going to cause discomfort for a while. So this is the approach we are taking here. We are taking an approach of a natural approach, one that can help reverse these conditions. And notice I say reverse, meaning that you didn't have it in the first place. And all these things can be reversed. They can be healed. Understanding the nature of it and where did it come from. The source. My colleague spoke about something we can inherit these things. What we have understand now is that people inherit more the food line than the bloodline. So while doctors may have a point where some of these things could be in the blood based on your family eating, but if your eating is different to your family, the chance of you getting that has dropped significantly. And any chance of your children inheriting that is going away. Because the problem is more in the food line, right? Not so much the bloodline. And we are saying, my brother Tom, our studio man, Tom, all right, in this most of the moment, we wanna call those numbers.
And those numbers are called 622-3937, 622-3937.
You heard it, people. 622-3937, 622-3937. You can call us right now in the studio, myself or Miguel, if you have questions relates to the topic at hand, which is arthritis, how we can detect it, prevent it, and reverse it naturally. So if you have these issues, take the opportunity tonight. It's free. Pick up your phone and call. 622
3937.
3937. You heard it. 622 3937. It's about you tonight. Ask questions. Understand how this thing happens and how we can prevent it. And if you have issues with your mobility, you're feeling pain, not able to move properly.
Hello, good night.
Good night, caller.
Good night. I'm having I believe it's arthritis in my knees, but more on the left knee.
Mm-hmm.
More on the left knee. Normally, I will take Divon. Pain, Divon works for the pain, but after a while, it will come back on. And when I walk in, it does be real pressure. When I sit down and I stand up, it does be real pressure. So I want to know what is the procedure and how to go about it.
All right, you sound like a young person. So I'll let my colleague Miguel, in terms of the physical therapy, what you can do to help this young lady.
Good night, ma'am.
Good night.
How long have you been having these issues?
We in March since last year.
Right. What is which area you have in this pain?
The left knee.
All right. It's slightly swollen, and the left knee, it's slightly swollen.
Okay.
So it's right as just in the kneecap.
So the kneecap itself.
Yeah.
That area around it. How that area is it when you feel it? How it feeling?
As I told you, it's swollen, and the foot does feel kind of stiffish.
All right, just
It
now.
does feel kind of stiff.
Is it? Let me go a little walk through. I'll get a little walk through how to check yourself a little bit. When you touch the area, how is it right now? Is it warm? Is it hot?
No, just normal temperature.
Right. the area around the knee, is it stiff?
If when I touch it,
All right. How it's feeling in comparison to the next knee?
well, the next knee now is only today the next knee giving me something, but the next one start from in the back. The
back
pain
of the
is
knee.
from in the back of the knee.
All right. When you first experienced this, what you was doing? Was that physical activity or you just woke up with this?
No, it just happened just so.
Your diet check in place with you.
Oh.
But from what you are saying, rheumatoid arthritis. That's from what you explained to me so far.
All right.
Which means you either inherit that genetically or it was through your environment. So what you explained to me from what you say is there's a thickening taking place around the knee.
Yes.
So
Yeah.
I need to check that physically, and you could come in at Natural Solution. Right? I'll give you the numbers so you can call and make an appointment. And
Yes,
All right,
our
so
numbers
I will
are.
listen on air,
Sure.
on air to hear the numbers that you're calling out.
right, that number is 222
222.
2189.
222 2189.
Yes.
All right then. I will be calling you all. Trust me.
Right. You could also WhatsApp us any questions that you have that you may while you come off the line that you want to ask any query, anything. You can
Yeah.
call at 304 5818
58.
5816.
Yeah, 5816.
That's WhatsApp. So you ask
Alright.
a question and we'll reply to you as soon as we get your message.
All right. Okay. Thank you so much. You all have a blessed night.
You're
Thank
welcome.
you. So again, people, we're going back to the foods we eat. We will adjust your diet. We will tell you what to eat and what to avoid. And sometimes people just have a little weighty. As we said before, the weight could cause some pressure too. And once we cut down the weight, the pain tends to subside a bit. So we work on your weight, we work on the bone structure. We want to get back So let me give you some things you can use naturally to help with the bones. We want to start with number one, my favorite, sea moss. Sea moss the needs. And minerals are more important than vitamins. You need minerals. The bone requires minerals. And drinking sea moss is going to help significantly. And the reason why I promote sea moss, not only is it good, but it's very affordable because most people can't afford liquid sea minerals that we have at times. So the minerals from the sea moss is quite good. You need to also get yourself a good quality collagen. And we want all 5 types of collagen, good for the bones, the joints, the eyes, the skin. It helps you to look younger, longer. Apart from the collagen, I also recommend what you can get things like vitamin K2 and D3. Vitamin K2 is a unique vitamin that will help to prevent the bones from losing calcium or leaching calcium. Because I said before, with the stuff you're eating, the acid levels are so high, the body's going to try to protect itself and it's going to pull minerals, it's going to leach calcium from the bones. As we get older, especially ladies, menopause and so on, the body starts to leach calcium very heavy. Some of you brushing your teeth, you notice it's at to bleed the gums because the calcium is leaching so hard, rapidly. And again, we can see these things in our hemaview, which taking a deep dive into the blood, we can see what's going on from the blood from the level of the body is losing alkalinity and is becoming very acid. It could become what they call acidosis, which is a very dangerous place to be. And so we can guide you in terms of what to eat to get the body back on par. I'm going to give you a free tip tonight as well. There's something called bone broth. Now you can buy this, but you could also listeners. And what you do, you take bones, could be chicken bones or whatever bones, and you boil it for you can get somebody else to make that. Use it like a chicken stock, which will help your gut and it'll help to protect the integrity of the bones. So it's an incorporation of a holistic approach we're using, not just to deal with the pain, but to bring back the strength and the integrity of the bones. We're not dealing with the symptoms. We want to deal with the actual issue, because the pain and these things are just merely symptoms. All right, we have a caller. All right, so what we're saying is that the approach to deal with the issue of bone health, as my colleague said, it can start from anywhere, at any age. All right, you wanna share something?
Yeah. I'll just give you all some facts. The skeleton that we have changes every 7 to 10 years. So, depending on how we treat our bodies, we create new bones every 7 to 10 years. The bone itself keeps the neurons and the muscles contracting. There's trillions of blood cells daily to create bone marrow. The comparison to your average elderly person bone every year. Most of the persons who are suffering from arthritis, their appendicular skeleton is affected. This means basically the arms and the legs. So anywhere from the shoulder to the wrist, you could experience pain, and this pain varies. I will go into the details of that pain just now. The bone consists of a red bone marrow, which produces blood cell, and a yellow bone marrow, which stores as fat. The osteoblast is what I was telling you about earlier. It produces a chemical that secretes as phosphate and other minerals from the blood. 1/3 of it is mineral, 2/3 of it is protein. At birth to 25, the osteoblast keeps producing collagen and phosphate. So what does this mean in layman term? It means that the body naturally produces collagen and proteins up to the age of 25. After 25, something called osteoclast tends to harbor the body more than the osteoblast. The osteoclast is the bone breakers, and they are basically used for bone remodeling. As you get older in the body, when you get older, because of what is happening internally, the osteoclast takes over and eats up the bone, causing the bone to remodel. Right? There's a process taking place where level tends to build up in the bones, causing a process called reabsorption to take place. This process is then followed by something called apoptosis. Apoptosis basically is when the osteoclast tend to older, where the bone tend to eat the bone more or less, because there's no collagen or anything to be reproduced in the body. When the body is working 100 and there's a balance within the body, there will be a cut-off time where the osteoblast will take over and reproduce bones. So this process of remodeling, it come like you're rebuilding your house. These are the people who are here to demolish. The osteoclast demolishes and the osteoblast builds. So you're looking to build the osteoblasts in your body. Exercise does this. I like to use heavy weights because it strengthens the bones, and it also tends to build bones, and it strengthens the bone, and it tends to remodel the bone internally by strengthening from inside, by bringing oxygen. It brings protein, it brings collagen, it brings phosphorus to the bones. Right? osteoarthritis here is based on my experience as a massage therapist. The osteo is degenerative towards the bone. So this is where the bone, the synovial fluid is leaking out. So it's bone onto bone where you get a pain. This one, there's no swelling at the joint. The joint itself is a friction thing where the bone is rubbing on the bone, causing pain. This one, you would observe that you will be getting a pain for at least 30 minutes every morning in a particular joint. It commonly impact the knee, the hips, the hands, and the spine. Affect a knee, or it would affect a joint. It wouldn't affect two joints at the same time. The risk factor for this is your age, obesity, your family history, the job type you have, the physical activity you're doing. This involves the loss of cartilage, and it occurs between two bones. Therefore, the bone tends to fuse together, decreasing the joint space. Spikes tends to form on the joint. This is why you will get the pains on a morning, right? The stiffness would be there for half an hour, whereas the rheumatoid is autoimmune and genetically disposed, in that you would inherit it, and it's also due to your environment. The sign of this is a thickening around the joint, where the area, the hands, and is very identifiable by palpitating, so you could feel the stiffness around the joint. And as we are dealing with therapies for rheumatoid, what we do at Natural Solution is that we break up the scar tissues. Now, this process is a little painful because remember, you would have had this mucus forming around your joint, which begin to turn to calcium, and there would have to be some force applied to the area in a rubbing action, causing these areas of the joint to be released. These scar tissue goes into the bloodstream, and then it goes into the waste organs of the body. So you tend to pass these out. Now, when you do this kind of therapy, you need to hydrate before and after the treatment.
That's a lot better than taking steroids, because a lot of people opt to do the steroids, which can the issue, the problem.
My experience as a massage, when you take, whether it be an injection or a tablet, the first time it will last 12 hours. As time passes, it will reduce to 10, 6, 7, 6. Sometimes it might last an hour as time go by. And these steroids in the tablet form is coated in a chemical which tends to affect the stomach. So you will be trying to fix a knee pain, but in the end you'll be damaging your stomach.
Yes, gastrointestinal problem.
So I advise people to do the non-invasive way of a massage, not because I'm doing it, but it's more effective. And when you're doing this kind of treatment, you need to adjust your lifestyle. You need to change how you're eating. Mm-hmm. You need to change your sediment life, this life of sitting down on the couch and watching TV. You need to get out and exercise. You need to make the effort to work on this particular body part, because you have properly, so that you will get the lungs.
Something you add, just one little phrase, but I think that a lot of people don't understand what it really means, and that's autoimmune. What is the meaning of autoimmune, and how does it manifest?
Autoimmune is basically what you're saying, that the body is doing damage to itself based on something is not functioning properly. It pull the nutrients and minerals that it need from vital organs and from bone. Remember, the bone has reserve minerals, and it's going to pull from the bones And it's going to use those minerals to shoot down the acid. So internal war is going on in the body to protect itself. So it's pulling here to supplement on this side. But in the process, the bone integrity begins to become compromised. So the doctor says autoimmune disease and you inherited and XYZ. But once you start to eat a certain way and you give the body what it needs, the body will no longer need to pull the resources from the bones and joints. You follow? So we are saying, let's look at the root of the problem. Let's look at the cause symptom. We aim to getting the root cause and addressing it mainly through the foods and understanding what we eat can cause an effect on the body. And when we do it that way, the body begins to cure anything. We can help the body by educating the body. And that's why one of our slogans, education will outperform medication. It's all about understanding what lives fast. Throw the food in the microwave and in 2 minutes, you have a meal. But these things play on the body. And so we are saying we need to switch that, and it will be a big difference with the body. As Miguel was pointing out a while ago, these things play a part in the body healing and the symptoms. We want to deal with the cause. All right, so it's a more causative approach on the symptomology. So we want to call those numbers, supposed to call in again.
And those are 622-3937 when I'm calling and all the ways on my phone. And this is free advice, people.
Free advice.
And
ask a question, people.
Yep. So 622-3937.
622-3937. I remember on we open on Monday to Friday at Natural Solution. We're at number 8 Osmond Road in St. Augustine. We are also located number 40 Wilson in Scarborough, Tobago. Number to call is 222-2189. WhatsApp only is 304-5816. You have a caller? Okay. So that's what we want to do. Inform, educate, prevent, reverse. We specialize in early detection and prevention. That's where our forte lies. Health is in trouble. As Miguel pointed out, you get a pain, a hump, a lump, or a bump. You're not sure what is going on. Pick up the phone and call, ask a question. Then answer a WhatsApp 304-5816. Ask a question that the young lady did a while ago. This thing can help save your life. For some reason, people like to, they reach sick and it manifests into disease, and they go by a doctor. You could use your alcohol and don't like that. So, Miguel, what we can do for the young lady and for people who have mobility problems, like from stroke or arthritis?
Well, we need to figure out the triggers in terms of what you're eating that causing the pain. From my experience, foods such as pepper, citrus would tend to give you that weatherman effect where you know the temperature changing and you would feel that pain in the joint, that stabbing pain in the joint. Right? Others would have immobility due to a stiffness in the knee where their joints moving up to a particular point and it seems to be heavy on the joints area, on the joint like a stone. Right? What I recommend in these cases is that you pay a visit and we'd use some heat to send some fresh blood into the joint so that the area with heated blood and the area that is starved, we could see if we could force some blood. We'd have to remove the scar tissue that is forming around the joint and blocking the oxygenated blood from getting into the bone area. This process could be done by something called gosha, where we actually scrape the joint to remove the scar tissue. The other method could also be also do some stretches at the joint, because people have this tendency that they get in pain in a particular joint and they cease to exercise this particular limb. They tend to cushion it. So pampering one particular side, you get an imbalance on the next side where a particular limb starts to shorten. And in shortening, because why? One side is contracted, it's not relaxing at all. So this particular part of the body
It's not being used.
On the other side, the muscle now start to do the work of the other side. So it petting one side where it is, you may be getting the pain, or the pain might stop. And just because in your mind, you know, this particular area was hurting me, when I do X, we tend not to put any weight on this particular limb, causing the next side to take the weight that it wasn't designed to take. So then you start to get the muscle not sure what to do. It don't know when to relax. So then you would have to do a next therapy now on this area, so that you would be able to relax this particular muscle, and then we would check the joint itself and see what level it on in terms of the arthritis. If you catch it in an early stage, well, let me get a story. There's this one client that I did. He into heavy labor. His job is more manual, right? And he observed a pain in the right knee. And he came to see me. I examined him and I gave him a little routine. And I'll be honest with you, he smokes. You had to work with me for you to get his pain managed. What do you want to do? You say, well, doc, I doing anything, you know, because I ain't able with his pain and I can't go in the hospital. So I started to see him weekly. And after about the third or the fourth visit, I will be coaxing him at every visit. You need to cut down the amount of smoking you're doing. And he was like, all right, I really can't deal with that pain, so I will try it. And I would see him once a week, and I'd give him some homework. Now he really, because of his lifestyle, wasn't practicing the workout part. So his process was a little longer than I estimated. But in the third session, he was like, doc, I had this pain in my back, I had this pain in my knee. I said, well, what I need you to do is to lend yourself to the process. And I want you to tell me which modality using you're getting the most relief of. So I started him with a deep tissue. And when he came back to see me, he was like, so then I ended up doing on the next session a hot stone therapy. In the hot stone therapy, he was able to get 12 days relief. On the next visit, I did a deep tissue mixed with some hot stones. And I did not see him for a 3-week period.
As results.
He was like, doc, I know you tell me to do something. I really take the rub and I feel so good I forget everything about the homework. I said, well, you need to do something exercise-wise. I say, yeah, what happened? When you go, me the stretch on the evening? He say, no. I say, well, let me do this for you. So I started to stretch him. He was able to recognize that the knee pain he came with disappeared. Now, I wouldn't lie to you and tell you that it is a walk down a rose patch. It's not. Because for the body to heal, you need pain to remove pain. Right? So it takes a level of pain to get rid of pain. But this pain, where you make up your mind to work for 15 minutes to an hour, and then you forget the pain you originally came with. Right?
You put the body under a little stress.
Yes.
The body works better when it's under a little stress. It builds. So, I mean, you heard it, people. These are the Meta Clinic to deal with the issues of pain, inflammation, discomfort, things like arthritis, stroke. These things really affect our body in a significant way. Of course, we educate you on nutrition, what you eating, what to avoid eating, to bring the body in balance. Again, a natural solution, this is what we do. Numbers to call are 222-2189. That's 222-2189. WhatsApp only is 304-5816. You can call us, and those of you calling who listen from Tobago, we offer similar services in Tobago as well. Our location there is number 40 Wilson Road in Scarborough, Tobago. So we're saying pick up the phone now. Don't procrastinate. We can still get 2 calls in the studio now. That number is 22-3137. We have a few minutes again.
And the lost opportunity, my friends, is something that doesn't come back. You might get a next opportunity next week, but dealing with something else. So
Something else.
give him a call on 622-3937. I have 4 blank lines here. That's
4 blank lines.
so good.
Well, it's not politics.
I'd like to mention also that for the month of May, we are offering, but I wouldn't go into the details tonight. What I need you all to do is look at our WhatsApp. To look at the WhatsApp, you call 304-5816.
We are also on Facebook. Just go to Natural Health Solution on Facebook, and you'll get everything that we have there. Talking about the special we're offering for Mother's Day.
And nothing beats the gift of health. So give mom the help.
Treat mom good, man.
Fathers don't feel left. Admin hours have Natural Solution and 9 to 5 on the weekdays and 9 to 3 on Saturdays. Right.
Yes, sir. Then call it, let your time run out. Don't blame me. But you can tune in again next week for more.
Same time, same station. It's all about you people. It's about your health. Be proactive. At Natural Solution, we love you. We love results. We are results oriented. We want to see things happening to you. And the testimonies are rolling in. And that is what we are into. We ain't doing business yet, but we're here to make an impact in the lives of people. So we're saying pick up the phone and give us a call. That number again is 222-2189. Our WhatsApp is 304. Like us on Facebook, just go to Natural Health Solutions on Facebook and you'll see information we have there available for you as well. God bless. Take care of yourself, TNT. Miss you next week, same time, same channel.
What am I saying? That was late night Natural
Health Solutions.
Right? So Natural Health Solutions, and you can check them out. Give that number again before you go.
That number is 222-2189. Our WhatsApp number is 304-5816. That's WhatsApp only.
All right. So make sure and give him a call and make sure that you could get yourself up and running, as it were. Yeah? All right.
Yes, my brother. Have a good evening.
And you have a fantastic evening as well.